And in which city and country are you based?
I'm based in Norwich in England.
Great. And what organisation do you work for?
I work for the University of East Anglia.
Okay. And if you were asked to describe what you do to a layperson, what would you say?
I would say I'm a lecturer and I carry out teaching and research, and my teaching is of health professionals, particularly in my own discipline, which is occupational therapy, but also physiotherapy, speech and language therapy, and other healthcare professionals.
Great. And do you do research as well?
I do research, yes.
On what areas?
I'm researching in long-term care of older people, particularly in residential care at the moment.
Great, okay. What is commonly understood as long-term care in England?
I suppose in England we would understand, most people would think in two different groups. They would think probably of people who need help and support over a long period of time in their own homes, or in residential settings, and that might include care with nursing care, just social and personal care, and I think those would be the categories that people would understand in England.
Okay, great. And what would you say are the three main policy priorities at present for long-term care in England?
I think the really huge one in England is how are we going to continue to fund it, because I think that certainly for individuals, then how they might fund their own care is of enormous worry and concern to them, and I think that all the projections, for the proportion of the sort of national budget that would need to go on it it's becoming unsustainable. So you've kind of got pressures both from individuals not being able to afford it and from the state not being able to afford it. So I think coming up with a fair and equitable way of funding long-term care is an important one. We have interesting situations in the United Kingdom, where in the countries of the United Kingdom, in Scotland, social care, I believe, is funded by the state, and the sort of personal social care that people might need at home, whereas that's not funded in England. So I think that's some of those equity issues are very relevant. And I think in also creating care that treats people with dignity and respect, and would be the sort of care that individuals would really choose for themselves.
Okay.
I think those are priority areas.
Great. And to what extent have these priorities changed over the last 5 to 10 years?
I think that I think they've probably been similar, but just become more and more pressing. I think the quality priority, I think a lot has been achieved personally. I think things have improved gradually over the years, over the 5 to 10 years, but equally we're perhaps expecting more. And then with the cost pressures, I think that's becoming ever more kind of to the fore and worrying. And I suppose then when those two issues come together, some of the gains and advances that have been made in understanding what would be good personalised care for individuals then gets compromised when when people are trying to provide that on a very, very limited budget,
okay,
as efficiently as possible.
Okay, interesting, yeah. And how do you see the system in England and maybe the UK changing in the next 5 to 10 years?
I would hope that we can begin to perhaps be a bit more creative, and where I said earlier in the beginning that people would see long-term care and they'd think people's care in their homes, care in residential settings or institutions. I hope that we could become more creative and have less of a sharp divide, and have some more sort of interesting solutions that draw on both of those. And I think that could be really important in addressing sort of quality issues and really getting at the sort of daily life experience that people who need care might be aiming for. But equally, I'm sure that there would be that could be cost effective as well. I would have thought.
Okay. And if you had the opportunity to introduce one new policy or reform, what would it be and why?
One new policy reform. I would want to put more resource in to care, and personally, I would be prepared that we would have higher taxes to pay for that.
Okay. And in your view, what is the most important piece of research evidence that we need in order to address and inform policy changes in England?
I think that we need evidence about how we can help people function at the best level and sustain their function. And again, it's probably thinking of this kind of huge divide between living in the community and then living in a residential setting, and that if people can have sort of reablement support that encourages them to be as independent as possible, but that can come alongside them, then I think that would be really important.
Okay, great. I have a few quick-fire questions.
Yeah.
Scale rating, 1 is low and 10 is high. I'll ask you 5.
Yeah.
So what policy priority is allocated to long-term care in England?
I'd say 3.
Okay. How aware is the general public about what the long-term care system offers them?
Oh, I think there's a lot of awareness and a lot of confusion, so how would I rate that? Probably a 4.
Okay. And how well does the system support people with long-term care needs?
Depends what those needs are. Again, very variable. I would say 5.
Okay. And how well do you think the system supports their carers?
I would say 3.
Last question. And how integrated do you think the health and social care systems are in this country?
Oh, that's a really interesting one. 5.
Great. Thanks very much.
Thank you.